Hi there, this is just a short video to present to you the anatomy of the knee so that you can hopefully better understand the nature of your injury or knee problem. This is obviously a plastic model of the knee from which the skin and fat and soft tissues has been removed to demonstrate the underlying anatomy. So I'll just orientate you briefly. This is the medial side of the knee or inner side of the knee, so the other leg would be on this side. This is the lateral side of the knee. So the first thing that we come to are the ligaments of the knee. Ligaments are the fibrous structures that connect one bone to another and prevent excessive movement in certain planes. On the inside of the knee, or medial side, we have the medial collateral ligament. This is a ligament that stops excessive movement of the knee in this direction, so excessive inward opening. It connects the thigh bone to the shin bone on the inside of the knee. On the other side of the knee, the lateral side of the knee, we have the lateral collateral ligament. This again attaches the femur or thigh bone to the fibula on the outer side of the knee, and it resists an inner bowing movement of the knee. Within the middle of the knee, we have the anterior cruciate ligament. So this ligament here. This runs from the front of the shin bone towards the back of the thigh bone and in a slightly angled direction. So this resists forward movement of the tibia on the shin bone, but also helps resist an internal twisting movement. At the back of the knee, we have the posterior cruciate ligament. This runs from the front of the thigh bone to the back of the shin bone or tibia, and this resists posterior movement of the shin bone on the tibia. Moving to the inside of the knee, we have these two structures which sit on top of the tibia. These are called the menisci. These are the shock absorbers of the knee. There is one meniscus or shock absorber on the lateral or outer side of the knee. This is the lateral meniscus. And there is one on the inner side of the knee or medial side of the knee called the medial meniscus. These are C-shaped rings of fibrocartilage that can frequently be torn or damaged. The other thing of note is the gristle surface or cartilage surface of the knee. This is a very smooth surface called hyaline cartilage that allows an effortless gliding of the joint. Moving back to the front of the knee, we have the bone at the front here, which is the patella or the kneecap. This is a bone that sits within the patella tendon here and the quadriceps tendon at the top. So the muscles that have been taken away attach into the quadriceps tendon here, and they act to straighten the knee. When those muscles contract, they pull on that tendon, which in turn pulls onto the top of the shin bone and straightens the knee joint out. The patella sits in a groove on the end of the thigh bone called the trochlea that guides its movement. So that's a basic introduction to the anatomy around the knee.